Alrighty, looks like Facebook Live is getting started here, so I will go ahead and get us going. Good afternoon, everyone. My name is Harrison March. I'm with Heritage Area Agency on Aging on behalf of our agency and the Caregiver Wellness Day Planning Committee. Thanks for joining us to kick off our 2021 Caregiver Wellness Series. You may remember in previous years we hosted this event in person, but last year we started virtually, and this year we're going to do the same thing again. We've got a 5-episode series that leads up through November. Just like last year, we've got some great speakers lined up and a couple who we will have introduced themselves in a little bit here as well. Our caregiver wellness events have been going on for nearly 20 years. We're excited to keep this one going. So again, a big thank you to those who are joining us, and shout out to our planning committee for all the work they put in to get us to this point. With that, I'm excited to be joined by our co-host and our MC for the event today, Barbara Warning.
Well, hello, everyone, and thank you so much for joining us. It's good to have everyone here today virtually. We're so pleased to be able to offer this presentation again this year. I'm Barb Warning. I'm the Executive Director at Heritage Area Agency on Aging. And yes, we've been involved in this event for over 20 years. It couldn't be possible. This event couldn't be possible without all of the endless hours and services that you all provide as caregivers. We know that, and we're still learning, that the impact that COVID-19 has had on caregivers is a profound emotional and financial impact. And we sincerely thank you for everything you do for your loved ones. This event has flourished because of the support of all of our sponsors. All of the dollars today from our sponsors are deposited into the Heritage Family Caregiver Fund to help pay for the needs and services to help caregivers continue to provide care to their loved ones. Today's event is sponsored by Home Instead, and I'll let Harrison take it away.
Meet Jeff. In his life, he's been to the bottom of the ocean, the tops of mountains, the ER twice, and all the places this guy runs off to. Like Jeff's, a life well lived should continue at home. Home Instead offers customized services from personal care to memory care, so older adults can stay home, stay safe, and stay happy. Home Instead. To us, it's personal. Meet.
And a big thank you as well to Home Instead's franchise owner here locally, Karen Huber, for helping us facilitate this Zoom webinar format. She's been a big supporter of the series, and like Barb said, really thankful to have their support as a sponsor for our first episode.
That absolutely, and I would like to as well thank Home Instead Senior Care for all of their support. They've been wonderful in the planning stages of this day as well. Right now, I'd like to introduce our speakers for today's event: Sam Jarvis from Johnson County Public Health and Greg Walston from the Iowa State Extension and Outreach in Benton County. Both of our speakers today are going to talk about COVID-19 vaccine distribution as it relates to barriers and accessibility. Now, during the time when they're speaking, if you have any questions, you can go ahead and put that on the chat feature at the bottom of the screen or on your Facebook Live feed as well. Harrison will be keeping an eye on those questions, and we'll be able to talk through them after the presentations have been made. So I'm just going to take it away with you, Sam. We'll start off with you, if you wouldn't mind introducing yourself just a little bit, and we look forward to hearing from you.
Yeah, absolutely. And thank you for having us. As always, we appreciate the opportunity to provide updates on our community's COVID-19 response. My name is Sam Jarvis. I'm the Community Health Manager here at Johnson County Public Health. I've been with the department a little over 3 years now, so I still consider myself newer to the community, but certainly getting my feet wet and getting to know a lot of folks and partners of the agency and everything. I'll start with the best news possible, and it's a good update that we've shared through our channels recently, but right now, Johnson County is leading the state in vaccination. So we're the highest vaccinated county across the state, and certainly within our older adult population, and even dipping down by decades, we are roughly looking at age brackets of 50, 60, 70 plus with an 80% fully vaccinated rate. And so we have a lot of folks in our community who are vaccinated. And so that's probably the best news that we can share right now. The other portion is that currently right now with our disease trends, we are seeing single digit cases across our county. And so our caseload has never been lower since the beginning of the pandemic, when we know also that testing was in high demand, and certainly the supplies for testing were strained a bit. So in terms of overall, we are in the best position we've been in throughout the pandemic so far, while still monitoring the situation with future cases and certainly the concerns with variants. But I would like to just kind of recap and really tell the story of how we got here as a community. And certainly, as many remember, not too long ago, within recent memory, December 14th at 9:42 a.m., the vaccine campaign kicked off for Iowa in our backyard here in Johnson County, with one of the first healthcare workers getting vaccinated. And since then, it's been a lot of communication and information, a lot of vaccine clinics being planned across our community, across the state. And really, I think the best part about this story is being able to describe the many partnerships across the community that made this happen, and really attribute the success of our vaccine rate to that. As many recall, during the initial rollout of vaccines, demand was extremely high and supply was very limited, as not every community was able to get the amount of vaccines they desired, that they needed at that time. And so it was portioned out by population. And certainly there are prioritized occupations, and at one point, age ranges. And so many of us know that long-term care facilities and hospitals were the first up to be vaccinated. And so we coordinated with our partners here locally to be able to do so. One of those is with our Johnson County Quality Long-Term Care Committee, comprised of a lot of long-term care, assisted living, and independent living facilities. And having that partnership and those established lines of communication were so beneficial to be able to make sure that we're all on the same page, and be able to know the expectations and timelines, and be able to get vaccines out to those more vulnerable populations as quickly as possible. We partnered with the Federal Pharmacy Partnership, which provided a linkage to a facility with a chain pharmacy, a large chain pharmacy that was in more federal planning to be able to provide vaccinations as soon as possible. And so majority of our facilities were able to start vaccination at the end of December and early January, and carry that forward for the next several weeks and months to be able to get that first and second dose vaccination in. And so really that was really the beginning of our vaccine campaign, coordinating with our hospital partners and on long-term care. Throughout time, throughout most of January, we began to work our way through other healthcare providers, whether that's other family clinics, other dental offices, other healthcare providers associated with hospitals and their own practices, and however. And we moved through those and looked at eventually what the state would refer to as their next phase. And then we looked at those who are 65 and older. At one point in time, many might have glossed over this small fact or kind of reality. At one point, there was age ranges of 75 plus. But knowing that other states had transitioned to 65 plus, that opened up a whole decade of persons age 65 and older to be vaccinated. So again, demand was high. And so we partnered with our hospitals to provide large community-based clinics and clinics elsewhere throughout the county. And we partnered with some of our pharmacies as well, who went on location out to high schools in Solon, at different parks and other areas to provide vaccination clinics across the community, so that we're doing our best to have access across the entire geography of Johnson County. And so we can't thank enough our partners at the University of Iowa Hospitals and Clinics, Mercy, Towncrest, and Nucara, and so many others, our partners at Hy-Vee, for helping us accomplish this huge feat. And continuing on from January, February, and until now, actually, those efforts are still going on. Vaccines are still being provided, and that support, that collaboration with all of our partners, the information sharing that helped keep our community on the same page and lower misinformation, address concerns and questions, was so extremely beneficial. And really, we can attribute our success as a community to all of those partnerships. It's strange to think that we're here today at a total population of roughly 60%, and knowing that we just started short of about 7.5 months ago, but we've come very far. At one point in time, we were releasing information and trying to manage expectations that supply was so limited that we might be still in a prioritized process by the summer. And we've certainly exceeded that expectation and again, all due to the support of our partnerships. We're in a wonderful position right now in our community that vaccines are widely available. And we continue to coordinate with partners to make sure that they stay available to other folks who, whether it's their working shift or other questions and concerns they might have, and be able to provide that so that at that moment in time, a person chooses to get vaccinated, that they have as little barrier as possible to do so. And now we're in a position where we're approaching the threshold that we know that unfortunately there's a portion of our community that will choose not to get vaccinated. Likely from what we look at a national trend, we may not be able to convince them otherwise, but we're closing that gap from those who really want to be vaccinated to those who are in the wait and see period, and to those that we more than likely won't be able to reach. But this past month, at the beginning of July, we were happy to announce age breakdowns that we were able to reach the federal goal of getting those who are 26 and older started or finished with vaccination, at least 70%. So we're extremely happy with that goal. We continue to do work with our partners to promote vaccinations, and again, a huge thanks to all of our partnerships, Heritage as well, for helping share that information. Harrison specifically, I remember many Zooms and meetings to continue to share information with all of our community members, whether they're in independent care facilities, at home, and otherwise. Throughout this entire time, we've been able to do other, we'll say, creative and other strategies, best practices to reach folks who either are homebound or have issues with transportation. We've coordinated with Johnson County Social Services on several occasions to provide information and access to services. So again, when communities ask and say, well, how are you doing it? Why are you so successful? Why is your vaccination rate so high? It's really due in partnership to all of our community partners that have helped with this, and our community recognizing how important it is to get vaccinated. So we can't thank our community enough and be grateful enough for that. But we know where we're at now. We know where we want to go. We want to continue to promote vaccinations and continue to reach 80-90+% of our entire community. Going forward, our next probably, we'll say, hurdle or our next goal will be when vaccinations will be eligible for those who are 12 and younger. Because currently right now, there's only one vaccine available for those 12 to 17. All three that are available at this point are 18 and older as well. So when we see that change, which we're hoping before the school year starts, or maybe it'll be right then when it begins, we hope that we'll be able to continue to plan and plan with our partners to be able to provide vaccinations for those school-age children. And so at this point in time and going forward, we're encouraging everyone, if you have children or guardians of children in that age range, and you have questions, to reach out now. Now's the time to get those answers from your pediatrician, healthcare provider, or a trusted source of information. So, but I think in terms of updates, that's really everything since December, in a very short synopsis, that is, but happy to answer any questions.
Thank you so much, Sam, and that really is good news. And we just want to thank you also for the good work that you and your team and everyone in the health departments have been doing just this last year and a half to keep us all safe. Were there any questions, Harrison, at this point that we wanted to bring up, or?
Yeah, we can do a couple now. Just regarding the news that we hear, it seems like more and more frequently about the Delta variant. So far, it seems like news has been that if you've gotten one of the vaccines that's already out there, you should feel confident, similar to before the variant, I suppose. But is there any sort of update in terms of that particular concern at this time?
No, I appreciate the question. And what you described is still the case. At this point in time, we're still hearing from our state and federal partners that all vaccines that are available here are still safe and effective against variants. And so that's good news. But there's always that concern in the back of our mind that if there are more variants or future variants that might become less susceptible from vaccination. And so again, while we're in a better position, time is still of the essence. We're still wanting everyone who's not been vaccinated to choose to get vaccinated. So I know that the state is monitoring that. They'll continue to report their surveillance to the CDC. It's been noted nationwide and very publicly that the Delta variant is in Iowa. It's likely the dominant strain across the nation. So we know that our friends at the lab and other federal partners are watching that closely.
At this time, Sam, are there any updates for long-term care facilities within Johnson County? I know you mentioned before that they were some of the first to receive the vaccine, and we all remember that they were also some hotspots early on, and it seems like that's been a positive trend. Not to invert my positive negative terminology when it comes to a COVID result, but trending well, I should say, over the last several months. And how is it looking on the long-term care facility front?
Overall, very positive. I think initially, as vaccines were rolled out and we saw enough time pass that the 2-dose series was able to be administered to a lot of facilities. I know that the state had noted a marked decrease in cases and outbreaks, and that continued throughout until this day. And so we know that long-term care outbreaks are few and far between, but they're still possible. And I know that there's been several news pieces across the state. There are some facilities that have lower vaccine rates in their facility. And so the work ahead of many are to either raise that rate to higher levels or to maintain it going forward. And so that will be one of the other items to juggle, much like now with other vaccination rates. But we know that specifically to take particular kind of consideration to COVID vaccination. So right now the news is positive, but we know that maintaining that will be the kind of the extra work going forward.
Thank you. And we got a thank you message as well to Sam and Johnson County Public Health for countless hours of work. I'm not sure if you want to try to count the hours sometime. That may be another insurmountable task, but certainly we at Heritage would echo that thank you. If there are more questions for Sam as we move along, they can be added to the chat section on Zoom or the comment section on Facebook Live. But with that, we can turn it over for now to Mr. Greg Walston.
Thanks, Harrison. Sam, quickly, a question for you, because I'm obviously not the expert in Benton County, so I would throw this question out to you, and I know it's a delicate one. What about the people in the county that have had COVID or have tested positive for COVID and have antibodies or situations like that? What's the practicality? What's the thought process on vaccination for them?
So far, we're still encouraging folks, even if they've been ill in the past with COVID-19, to still get vaccinated.
Okay.
We know that after being ill and recovering, there is some immunity, and I believe that continues to be information that it lasts for several months, but we're still encouraging folks to get vaccinated either way.
Sure.
The only time that we're wanting folks to maybe take a pause is if they're in their actively infectious period. But that's primarily because we don't want to expose other folks. So,
sure. Well, I appreciate that answer, because I don't get a lot of questions about it being in the job that I'm in, but I know that's kind of one of those gray areas that especially rural Iowa would have more so with the COVID vaccine, things like that. So thanks for help on that. So,
yeah, of course.
Like Harrison said, my name is Greg Walston. I'm the County Extension Director for Benton County, Iowa State University Extension and Outreach. I don't know how big of an audience we have this afternoon, but if you're not from Benton County, I'm hoping you would at least know where your extension office is. It's usually in the county seats of most of your counties. We have 99 counties throughout the state, and we have 100 county extension offices. The extension program is designed to bring information from Iowa State and other sources to each county resident, and we've all celebrated at least 100 years of an existence in the state, and it's a nationwide extension service too. So some of you are probably familiar with Penn State, the Ohio State, a lot of those states that are involved have extension services as well. So probably you know us from being a master gardener. You may know us because we're ag programming. Our other brand name is 4-H. So if you know anything about 4-H, you know that we're the 4-H partner here too. Anyway, I will bring you up just very minimally on my COVID knowledge. And I am like maybe 1/1000th of the knowledge that Sam has and as a professional, but I will tell you quite candidly, we've worked closely with our county health person. Katie Cox is our county health nurse, and Katie's done a tremendous job. And Sam, I don't know if you worked with Katie or not, but she's done a tremendous job getting the word out initially for COVID, and being a rural county, it's a little bit more of a struggle to get COVID information out to people. So initially, I think just like Sam indicated, in Benton County, we went through a phase of age and then what exposure you had. I was lucky enough that, and this is what I'll have in part of my presentation, I have a 90-year-old mother, and because I'm her caregiver, I was able to get the vaccine February 1st and then March 1st. And so I felt fairly confident and felt pretty secure in that COVID was, hopefully not going to be a situation for me. Not that I couldn't get it, but I felt very much protected. I had lots of other people. I'm 63, had people my age that were starting to get the vaccine. And I think a lot of people felt that was necessary for them to do that. Went through, of course, all of the closing the offices, doing lots of Zoom meetings, things like that. So we've kind of gone the full gambit here as the extension office. We were fully closed for probably about 2 months, 2 months and a half. And then because of our 4-H output, we also had a limited Benton County Fair. We had the Benton County Fair on a by invitation basis. So we allowed our 4-Hers to have approximately 8 family members or whoever they chose to come into the fairgrounds and show their livestock. Because it was outside, we felt a lot less, we felt very much safer in that regard. And any face-to-face exposure we had, we limited it and did it in a different venue. Coming into the fall, we did a lot of meetings, but we did meetings in a whole different way. We did a lot of Zoom meetings with our ag partners. We also did larger community centers where we could social distance. And believe it or not, farmers even wore masks. So that was a little bit difficult. I had a few grump and groan at me that like, what, you really requiring it? Yeah, for your protection and ours both, fella. So we did. I'll just say that from a personal practical perspective, we had had to and some of you that are more rural might understand that a little more than others, but the objection to wearing a mask was somewhat there, but we came past that, and I feel like we did the safe thing, and so I feel like a lot of people are feeling a lot more secure about COVID than they were 6 months, 8 months, 10 months ago. I feel like we have a lot more knowledge about it too. I do, like Sam, believe there's a lot of miscommunication. There's a lot of misinformation. So I would encourage all of you to either get a hold of your public health people, your doctor, or Iowa State. If you would go on our website, we've partnered with the state to have current information on all of our web pages. And if you want to go on our state web page, you can. It'd be just Iowa State University Extension and Outreach, just in general, and type in COVID, and you can find a plethora of information on what's going on, what's current, and things like that to back up what Sam is talking about in Johnson County. And I know Johnson County itself, Extension, has done a good job of helping promote some of the education as well. the other thing that I noticed that we had unique, not unique to us, but unique to our area, was we had this nasty thing called derecho that occurred in August, and it complicated the issue a lot in our county. It was about 2/3 to 3/4 of our county was hit by the derecho, and so it put a whole different spin on things. About 2.5 weeks after the derecho hit in August, we had a meeting with farmers because they were the worst hit, and we had about 200 farmers that were socially distanced in a very large building, and we were still able to put on a webinar or a meeting to discuss some of the things that they could do, and some of the things help to fix some of the problems that were occurred because of the derecho, or some of the solutions to crop damage and things like that. And so we felt pretty good about allowing some kind of a meeting to happen and still be able to feel safe with. Harrison, I talked too long, right? Here we go.
No, that was my apologies.
That's fine. So we were able to continue on as much as normal, but I think that's just another thing that's complicated the issue for us. And now on the caregiver end, I can personally attest in Benton County, a lot of our nursing home and care facilities, like everybody else, shut down. We're limited, if at all, family, some very limited family, but I do hear them opening up quite a bit now and are back to, I wouldn't say normal, back to at least people being able to get in and see. On my own personal end, I actually happen to be a Eucharistic minister for our church, and I'm still waiting to get back into the nursing homes to help give communion to those that want it. So that personally tears up my heart that we can't get back into the care facilities and do something that's very, very near and dear to my heart. So, but the other thing that I wanted to say, and Karen conned me into being on this presentation, was, I don't know if any of you have taken the class called Powerful Tools for Caregivers, but I would highly recommend that you take the class. Karen and I have known each other for a while, and she helped me put a class together. We had about 9 of us in a class, and the class is basically designed for what it says. It's powerful tools for us as caregivers. And as I alluded to earlier, my mother being 90, I have my frustrations with days that I go to see her, and communications, forgetfulness, things like that. And it was a good way to, it's a 6-week course, I think. And it has a workbook with it and gives you a lot of good information on how to take care of yourself while you're taking care of the people you're giving care to. So I would highly recommend that you seek out Powerful Tools for Caregivers, and not to try and put too much of a cheap plug for Iowa State there, but we're going to, I think as of the end of the month, Iowa State will become owner of that program. And so I would ask you to reach out to your extension offices and find out. I know right now all the classes can be done virtually. And while that isn't perfect, I think you'll still get a lot of good out of it. So I would highly recommend, if you are involved in caregiving personally yourself, or obviously some of you are involved in being involved in caregiving as professionally, I would highly recommend taking that class and getting involved in it. So I thank you all for allowing me to put a little plug in for that as well. So I think that's about all I have. I do have all kinds of websites and stuff. If anybody would like to, I can give you, if you want to go to your local extension office, they're very easily accessible on the web. Just type in your county name and your ISU extension and outreach, and you can find it. Or if you want to go to the website statewide, just ISU extension and outreach and statewide, and you can find your local extension office. Or even if you're not from Benton County and want to stop in and see me, I would be more than happy to visit with you anytime about a lot of things that we do. We obviously have our fingers in a lot of different things. So, but that's my portion of the presentation today. And as I warned, it's not very much material, but it's a lot of talking. So I'd take any questions, or Harrison, if you have any other thoughts or concerns or.
That was wonderful. Thank you, Greg. We did get a question about the Powerful Tools course, asking if there is any cost for that, or in terms of getting, started up with the program, how should they contact your office?
Good. Let me see if I can do my share screen thing here quick. And oh boy. All right, let me get to that. I'm limited techie here, ladies and gentlemen, so okay. Can you all see my screen?
Right now, we can see your calendar.
Oh, sorry. Okay. Let's see how can I make it share? Can you see it now?
Yes, we see the
Okay.
Extension and Outreach webpage.
Yep. And you see, here's our COVID resources page. It's just on the human sciences side, and that would be also where you would find answers about COVID, things like that. But here is the family side of our human sciences page. And what I would suggest is just go to your Iowa State University Extension Outreach page, click on Powerful Tools for Caregivers, and it should give you when the online courses are happening. And yes, for most of them, I think it's a 6-week workshop, $40 per person or couple. And sometimes they're sponsored. In our case, we got part of our sponsored, and we actually had a free meal involved in it because we had it face-to-face with masks. And so we had one of our local care facilities that had a Alzheimer's unit that was wanting some help. And we were lucky enough to get a lunch. It was a noon lunch and learn kind of a situation. And so we had lunch with it at no extra cost. So yes, in answer to the question, it's normally $40 per person for a 6-week course. That includes a workbook that also includes there's 2 different books, and then all the contact information necessary. And you have 2 professional presenters, usually at the courses, that will give it to you too, or you can make contact with as well. Did that answer the question, Harrison?
Yes, thank you. Yeah, it looks like it got at another question too, which is where to find information about other programs for older adults as well. And it looks like you've got a great hub there on your web page.
Yeah.
And I'm sure that if folks want to call in as well, that information can be given out over the phone, I would imagine.
Right. And I can give, if anybody has pencil, I can write down my office numbers: 319-472-4739. And that's the Benton County Extension Office. I can repeat that again: 319-472-4739.
Thank you.
Yeah, that was just an example of what the web pages. We have tons of web pages, and I'm good at clicking on them, finding information, but I'm not always as techie as I should be at sharing the link and all those things. So I apologize.
Well, thanks so much, Greg. Harrison, we appreciate all of your information. Greg, was wonderful. Thanks so much for taking the time to share all of that with us. And we're going to open it up now to a few more questions. Harrison has been tracking those for us on the chat function and the Facebook Live feed as well. Do we have any other questions coming up, Harrison?
We've got a couple more right now. One of them is about where you can find statistics and data about COVID cases, whether that's available statewide or by county.
A great question. So currently the state is still sharing information on COVID cases on their state website, or their state, we'll say, dashboard. They are updating those on Wednesday mornings. And then I know that all of the information regarding long-term care facilities has been archived, and it's still available on the site, but they're no longer updating those. At this point, the state has noted that they're archiving several of those pages and information to clean up a lot of the links and information. As we all know, information change daily, weekly, at different various points of time. And so they're looking to remove outdated information and have just up-to-date and those that is information that's most pertinent right now. So that's still hosted on their site at coronavirus.iowa.gov.
Thank you. That observation that so much change daily, weekly, and monthly, really emphasizes how much we're all learning in real time as we keep going on. So one final question we've got right now, and that's not to cut it off if anybody has another one to throw in here, but that's regarding these coming few months as we look ahead to fall, winter, and wonder about flu season. I know last winter in particular, there were concerns about how the pandemic would sort of layer on top of that. What advice do you have to offer for caregivers right now or for older adults who may be concerned about the upcoming flu season and maybe things like mask wearing, social distancing, things that we were more used to doing maybe, a year ago? Should we be considering those again?
I think the entire nation, the entire world learned that when we do those other mitigation measures like physical or social distancing and wearing masks, we can prevent illness. For the first time in memory and probably for quite a while, when we looked at flu surveillance, the entire state, the entire nation saw virtually 0 cases of flu or very limited cases. And we know that that was due to our behaviors. And so I think that's a learning point. Again, vaccination is available. So we'll encourage folks to continue to get their flu vaccine as well when the time comes later this fall. Particularly they look at the latter end of September, October timeframe for persons. But if there are certain situations, and it certainly behooves if someone feels more comfortable wearing a mask out in public. These are things that we can all do now. And so even if without a mandate or without maybe as high of an incidence of COVID or even flu cases, these are things that we can still do and employ to protect ourselves and others. So I think there's tolerance to wearing a mask out in the winter months a bit more than there's the summer. It kind of helps keep our face warm. So that's an added benefit. It's like a lighter scarf.
Thank you. As we look ahead then to, things changing and updating, learning more, how should people contact both of your offices to sort of get updates on the latest information, advice on how programs may be changing, whether that's, restrictions or more things becoming available too, if things continue to go well? How should people contact your offices?
We always welcome the public to give us a call at 319-356-6040. Ask to talk to myself, a disease prevention specialist. We'll continue to share information on our site and our social media as things change. At one point, it felt like we were updating things daily, maybe twice a day. We know that we've seen the cadence change a little bit, which we're grateful for, down to a week, and now I believe we're at bi-weekly at this point. But we'll continue to share information because we know, one, it's important, and the pandemic is not over. We want to keep everyone informed as we make progress, and if there are any other notable changes. So, as always, if there are any questions about COVID-19, please feel free to reach out to us.
Well, thank you both, Sam and Greg, today. Your presentations were great, such valuable information, and we really appreciate you joining us. They've both graciously shared their phone numbers, and we will have them on our Facebook feed. I know if you have any of you attending today, if you have questions later on, feel free to reach out, get in touch with either the Extension Office or the Public Health Department, and I know these folks are happy to help you in whatever way they can. And also a huge thanks to our sponsor for today, Home Instead Senior Care, and to Karen Huber and her team. They have also been wonderful to work with. So many people, it really does take a community, doesn't it, to keep us all well and safe and provide all this great information. All of our webinars today, including this one, or in the series, including this one, will be saved on our website at heritageaaa.org. So feel free to go out there and you can get the resources as well. Harrison, do we have anything to add before we adjourn for the day?
That's all for today. I echo your thoughts and thanking everybody who made this possible.
I would interject here. Thanks to both of you, Barb and Harrison, for putting on a professional show here. That was very, very necessary and very educational for me. And I appreciate Sam's help too. But thanks for doing this for people. This is awesome. So it's good to know we've got good partners out there.
100% agreed. I appreciate the opportunity to share and provide updates. So thank you. Thank you, Greg.
Well, with that, everyone, we hope you have a lovely, safe, and healthy day, and we will see you again next month for the next part of this series. Thank you all.